Get going. Hey, everybody, welcome back again to another opportunity to meet and greet with some of our excellent Lipedema Simplified coaches and other people that are going to be involved in our event coming up on April 12 to 14. I'm Leslyn Keith. I'm the president of the board and director of research with the Lipedema Project. And I am here today with one of our wonderful coaches, Sharon Tillery, and she is going to be at the event also. So make sure that you come to the event so you can meet with Sharon. But we wanted to talk a little bit today about what you do, Sharon, and basically all about you, because I'm so fascinated what you do as a health and wellness coach. So go ahead and tell us a little bit about yourself and how you got into this and how you got involved with lipedema.
Okay, well, welcome everybody. Hello. Again, my name is Sharon Tillery. I am a health and wellness coach here at Lipedema Simplified. I got into the lipedema community via a surgeon I used to work with. His name was Nadeem Shapira. He was like a thoracic surgeon at the hospital where he was, and then when he left there, he opened a med spa. He and his wife, and he specialized in vein surgery as well as lipedema. And so I was his medical assistant, which I set up all the ER for all of his vein surgeries. At the time, they were called liposuctions. I think it's lipedema reduction surgery now. Is
Yes,
that what?
sometimes that's what they call it, but often
Okay.
just saying liposuction. Yes, yes.
Yeah. And so I was his assistant in every surgery that he did, setting it up, taking care of patients. I know it may sound gory to some people, but when he would use the, oh my gosh, what the
Yes,
domestic solution to numb the person.
right.
And then we would have to, after the surgery was over, we would have to kind of squeeze it out and reshape
Mhm.
the leg to get all the fluid out. I think that was the best part of the surgery for me. But anyway, taking care of them. So he taught me a lot about what to look for in lipedema patients, what it looks like, what it feels like to them, the cons in having such, you know, uh, uh, um, I don't want to say disease, but such a situation going on. He really helped me to understand a lot of what was going on. He's really, really, really a advocate for lipedema patients.
Mhm.
And so that's what prompted me to be. So when I left him, I wanted to still be a part of the lipedema community. Didn't
Mhm.
know how to do that. But when the pandemic hit and I was like, gosh, I need to refocus and see, because patient care wasn't patient care. We had
Right,
no patients at all. And I
right,
love that connection with
right,
patients.
right.
So I figured like I love talking to people, even though I'm like I'm one of those people that like to be in the background.
Mhm.
I don't like to be out front, but I do love talking to people and just hearing their stories and how I could, be able to help support, in any way that I can. So learning what as for a life coach was, and it was very interesting because I hadn't heard it before. But I was like, oh, that sounds really interesting. And during the life coach, I did an online course, and then
Mhm.
that they had a health and wellness part of that,
Mhm.
and I took that. But then I went back and took another course in health and wellness and a spiritual health life coach
Mhm.
um, program, and that's how I kind of met Catherine. I kind of stalked her because I really,
Mhm.
really wanted to be like, I loved what her website was offering to
Mhm.
lipedema patients and how compassionate she was, and just all the various avenues that she has for lipedema patients and people trying to figure out if they had lipedema or lymphedema, or even other things that associated with it. So
Yes.
I kind of stalked her. I did. I kept reaching out to her, and she was like, she's very busy,
Mhm.
when once her seasick was over, and then she was into something else, and so I was like, it's okay, I'll be patient, I'll wait. And the
So
way you paid off.
Sharon, you have such a unique and such needed skills. I mean, a combination of having the information about surgeries that are used for lipedema, having an awareness and an understanding of the condition of lipedema, having training as a life, coach and health and wellness coach. Wow, what a combination. And I'm so glad for your persistence because you're exactly what the lipedema community needs. Thank you so much.
You're welcome. I'm excited. I'm always excited to be a part of the C6 and the webinars and all that, Lipedema Simplified and Lipedema Project has to offer. I think it is amazing, amazing organization. And I am grateful for every moment that I'm able to spend with such an amazing community.
Mm-hmm. Yes. And, this is a question that people ask a lot. As soon as they figure out that they've had lipedema, they want to know about surgery because there's a lot out there about surgery for lipedema that, you can have obviously a huge reduction in size and a huge reduction in pain. And they want to know more about it because it seems like such a fast thing to do. But then they don't know where to start. And wow, in order to talk to you about that is huge. But since you've been in the field, you have experience with that. But not only that, as you're training with a health and wellness coach, some things for them to consider before surgery, if they even want to do surgery, if they do surgery, what to consider after surgery. I mean, the possibilities of meeting with you are endless. So I'm just so grateful for you, Sharon. And just so everybody knows, we're having our event, our virtual event conference happening on April 12, 13, and 14. It's Keto and Beyond, more than just nutrition, but everything else associated with that. And Sharon is going to be there. And if you would like to meet with her, perhaps probably in very small groups during the breaks, stuff like that, you'll find out about it at the event. This is going to be a wonderful opportunity to really get all the information that Sharon has, an opportunity to learn from her and to be able to talk with her. So information is below. Make sure you check that out about how to register for our event and have an opportunity to meet with Sharon. And just a little bit more about what you do as a coach for Lipedema Simplified. What types of things if someone was to meet with you as a coach, what are the kind of things that you typically work with people on?
Well, a lot of questions are about, I have a few questions about, like the wound care, like after surgery.
Okay. Yes.
And what our doctor used, or what was the process of it all. And then questions about the difference between I can't remember the name of it, but I know a few of them was like, what was the difference between lipedema and another like Durkheim's or something like that, because
other similar disorders.
Yes, because they kind of related in certain areas and stuff like that. So I talked to a lot of a few people about those things, and just in general, like the state of mind, and
with your spiritual training, that's coming in to help with that, just that whole state of mind and perhaps being overwhelmed.
Yeah. And that's why I love Catherine. She has this beautiful the picture on site with the holistic aspects of healing. I mean, the holistic aspects of the approach and what each dimension means. And so it is a beautiful thing, but I know everybody kind of takes a part in different ones, but I'm really I like the spiritual part of it, because I think it goes hands in hand with the mind, body, spirit healing. I think it goes hand in hand with, although people don't realize, like when they're searching for answers with lipedema, they are really tapping into that spiritual side of them as well. And so
Yes.
this all kind of fits hand in hand together. But a lot of people, I guess they just want to know that somebody cares, that
Yes.
somebody is in their corner, that support system that they need is right there. So that, again, that part I love. Like, I love
Yes.
that part.
Absolutely. Yes. Yes. And I want to just draw everybody's attention to there's different ways to search for us and find out more about our events and stuff like that. You'll see below there is our hashtags for you to search for us on Instagram. Be sure and check those out below. You will find us from that. Also, we have a calendar of events, so one-stop shopping, and you can find other Facebook Lives, other webinars. For instance, I have one this afternoon. So check out that the link to go to our calendar. And thank you, Gail. She just popped up right there about the webinar I'm doing this afternoon, Nutritional Strategies to Support Lymphatics. And that's happening 5 p.m. Eastern time today. So be sure and register for that. If you register, you will get the replay. So even if you're not available at 5 p.m. Eastern, you can still get my replay. But back to you, Sharon, because what you do is so fascinating and such a huge support for the lipedema community. And it sounds like that people will also consult with you just if, where do I go for a diagnosis? How do I figure out if this is what I even have? And so, of course, we have our provider directory on lipedemaproject.org, but I think people like to connect with someone. They like to talk with someone. And for you to now be someone that they can access virtually, I mean, that's one thing, the good thing that happened out of the pandemic is that you got all this online training and now you're available to people online.
Yeah.
So how do people find you? Where should they go?
They can go, I think, did she put it in? I think, well, it says Sharon at lipedema /signified, not slash, I'm sorry, hyphen simplified.
Here we are. There is your email, Sharon at lipedema-simplified.org. Yes. And if people also, so that's your email, but people can also go to lipedema-simplified.org and then go to the coaching page.
Yes.
And you're also there.
Also there.
Yes. So, I should let people know too that, I mean, that we have something called like a discovery call or that it's like a free 20-minute.
Yeah, absolutely.
Just so people can connect with you. Tell people about what they can expect in that just free 20-minute consultation.
So it's what, like, I like to call it a discovery call because we're just discovering what the need is of the client and what actually they really want. And then we'll take it from there on how to go about to get it. So they'll just, I'm a great listener. Mostly it's just me listening to them and them telling, expressing what it is that they're looking for, their desired outcome, and how, I can help them achieve that. But again, it's mostly that call is just initially about the client and what it is that they're looking for, what they desire, what strategies they've already tried, what did work, what didn't work, and then we'll take it from there.
Yeah, because I think that there's a lot of things that they've tried already. They've gone to their doctor and then their doctor doesn't even know what lipedema is. They've talked to friends and family. I mean, they've searched things on the internet and maybe they found some good and bad information. And how do you sort through that? How do you figure out what is good? And so you may be that first person with that gentle ear that is going to listen to them and help them sort everything out in their mind. And they may end up being your client, or you may just give them a direction. They'll go somewhere else. Just having that.
Client. I'm sorry.
Yes.
Yeah.
No, go ahead.
I just had a client that we did that. We went through that 2 weeks ago. She had questions about where does she start from here. She doesn't. She thought she had a lipedema, but I reached out again to Dr. Shapira. He gave me some advice to give to her from the description of pain of what she was going through, which she described to me. I sent him her email, and he gave his take on it. So she had successfully made an appointment with someone in her area, and she wanted to make an appointment to come over in Delaware to see him as well. So
Yes.
absolutely.
So, and that yet another thing you bring to the people with lipedema is you also still have that resource of Dr. Shapira, and he's willing to help out whenever you reach out to him. How wonderful.
Yeah. Yeah. Beautiful. It's a beautiful network. It's a beautiful network. Yeah.
Yes, being part of that, that family and connecting, helping people connect with what they need to, where they need to proceed and on this journey, which a lot of people are confused and stuck, and you're untying the knots for them. Thank you so much, Sharon.
Thank you for putting it that way. I didn't think of it like that, but thank you.
And so just a reminder, if you would like to meet with Sharon or all of our other wonderful speakers and other attendees, this is an opportunity for everybody to communicate with each other at our virtual event that's happening April 12, 13, and 14 about keto and beyond nutrition, but also, all the things that come into nutrition and continue on your journey with lipedema and lymphedema. Information is below. Be sure to connect with us. Sharon, thank you so much for being here with me today. It was wonderful learning more about you, and I hope that you are going to be very busy in the future.
I like busy. But thank
good.
you so much, Leslyn, for having me as well. I enjoy talking with you.
Thank you. Bye-bye, everybody.